So what is lipid? We have frequently heard this. Lipid, carbohydrate and protein, these are essential nutrients for cellular function or body's optimum functioning. Now these lipids are of different type like cholesterol, triglyceride, LDL, VLDL, HDL, etc. Lipid is an important constituent of body's metabolic function, so it is very important for cell membrane function and steroid hormone synthesis. But if due to any cause like genetic predisposition or some disorders like diabetes, hypothyroidism, etc., or due to our lifestyle disorders like excessive eating of junk food, etc., if this lipid is increased in our blood, then several problems may happen in our body, including cardiovascular malfunction. The cardiovascular malfunction may represent as coronary artery disease, atherosclerosis, myocardial infarction or stroke, etc. So, by lipid profile or lipid panel test, we check what is the different lipids range or quantification in our body, like TG, cholesterol, VLDL, LDL, HDL, etc. For a lipid profile testing, a subject or a patient must be 10 to 12 hours fasting. Fasting means it is stringent or strict fasting, only plain water is allowed, nothing else. Also, if the patient drinks alcohol or soft drink, etc. on previous night, the lipid profile result may be falsely elevated. So please remember that the patient will have to be fasting, only plain water is allowed and nothing else. Now we will come to the parameters of lipid profile testing like total cholesterol. Usually it is said that the desired total cholesterol level should be less than 200 mg per deciliter. Similarly, for triglyceride, it should be less than 150 mg per deciliter. HDL is a good cholesterol, so it should be more than 60 or equal to 60 mg per deciliter. LDL is called a bad cholesterol. It should be less than 100 mg per deciliter. Why LDL is a bad cholesterol? LDL itself is not a bad cholesterol because LDL is important for steroid hormone synthesis and many other functions. But if LDL is increased in blood, then what it does, it transports cholesterol into vessels of coronary arteries like coronary arteries, and it leads to atherosclerotic plaques, and which may lead to myocardial infarction or stroke. That's why we have to keep the LDL level as low as possible. HDL is a good cholesterol because it protects from myocardial infarction or coronary artery disease, because it removes the excess cholesterol from tissues and plaques, tissues and coronary arteries, and sends back to liver for recycling. So that's why it is called a good cholesterol. So for cardiovascular health, we should have low cholesterol, low triglyceride, low LDL, low VLDL, but a good amount of HDL. There are certain other parameters also like cholesterol HDL ratio. We have to keep the cholesterol HDL ratio within 5. If it is more than 5, it is bad for your heart health or cardiovascular health. So if we have to keep the cholesterol HDL ratio within 5 so that your cardiovascular health is in good status. All these biological reference limit, as I discussed for cholesterol, triglyceride, HDL, LDL, has been developed, or we follow the guideline of National Cholesterol Education Program Adult Treatment Plan Type 3. Thank you.